If you are a parent making decisions about activities to put your children in, please also listen closely. Many of my patients ask me this question: where does fibromyalgia come from, or why am I in chronic pain? I'm going to answer that question based on what research shows, and definitely more research is needed, as well as what I see in clinic day to day, because the answer is not simple. Many of the patients we see who were referred for chronic pain issues and having a diagnosis of fibromyalgia disclose years of competitive sports during their growing years. The most common sports cited are dance, gymnastics, and competitive swimming. But some just did multiple sports continuously throughout these years, and then later didn't continue doing them. This stimulus has an effect while the body is forming. What the research says, right now, research does not show a direct cause and effect link between competitive sports or overtraining in younger years and developing fibromyalgia later in life. So we cannot say that sports definitely caused it, but that's not the full picture. Because the vast majority of patients that I see have the diagnosis of fibromyalgia will tell the same kind of history. And this is why I want to make parents aware that moderation could be more important than we realize until we have more research. What we do know about overtraining: in high-level or competitive sport, the body is often under constant load. Long training hours, repetition, pressure to perform, and often not enough recovery. Research on overtraining shows that this can affect the body's stress systems. People can develop persistent fatigue, poor sleep, reduced recovery capacity, and changes in how the nervous system handles stress and effort. What we now understand about fibromyalgia is that it is not just a tissue problem, and it's not explained by one single cause. For a long time, we focused on something called central sensitization, where the nervous system becomes more sensitive over time. That is still a big part of it, but newer research is showing that it may even be more complex than that. We are now seeing involvement of the immune system, with possible low-grade neuroinflammation and changes in small nerve fibers in some people, and even differences in how the body processes pain signals at a deeper level. There is also growing evidence that genetics, sleep disruption, stress, and even past infections can all play a role. This is not one condition with one cause, it's a system that has become dysregulated over time. And this is where things start to overlap. In both overtraining and fibromyalgia, we see changes in fatigue, sleep, recovery, and changes in how the nervous system responds to stress. So while one doesn't directly cause the other, they are not completely unrelated either. They both involve a system that has been under load for a long time without enough recovery. What I keep seeing in clinic is that many people who come in with chronic pain were high performers, athletes, dancers, people who pushed through discomfort for years. They were used to overriding signals from their body. Keep going, no pain, no gain, push harder, don't stop. And over time, that system became overloaded. If this is you, realize that your body has been under stress and tension for a long time. And now multiple systems are struggling to regulate properly. Not just muscles, but the nervous system and recovery systems, and in some cases, even the immune responses. This is why just chasing pain doesn't work, because the problem is not just where it hurts. But when we reduce tension in the body, the whole system can feel relief. And that's why we look at patterns. We look at what is pulling on the body, what is staying tight, what is not switching off. The good news is things can feel better, but it does require a shift from pushing harder to understanding your body better, from ignoring signals to learning how to respond to them earlier. If you're trying to figure out where your pain is really coming from, inside the myoMassage app, I guide you through simple tests to help you to find the actual source of the tension in your body, so that you're not guessing and not just treating symptoms. You can start here, myomassage.myoclinic.ca.